Good morning, everybody. Thank you for joining us today. We're at a really critical point and a historic moment in our efforts to end the pandemic and to return to a lot of the activities that we've all been missing over the past year. And I think people are getting a taste of that with concerts, games, restaurants with friends, hugs with relatives. It's all getting pretty close if we can stay focused here. And as we've repeatedly said, this is a race. On one side, we've got the COVID-19 vaccines, and they're more accessible than ever in our community. We recognize, and Dr. Moyer is going to talk about this right when she gets, before she presents the data, the pause that's on the Janssen vaccine right now due to some issues, 1 in a million on some blood clots in some women ages 16 to 48. So we have to understand that, very rare issue. But we know the vaccines are safe and effective is vouched for by medical professionals from here all over the country and all over the world as well. We've had a significant increase in availability of the vaccine. It's now available to anybody 16 years old or under the new guidelines by the governor. So we've got lots more vaccines on one hand, and on the other side, we've got the variants, right? That's one of the things that keeps a lot of people up at night, including our public health experts, because we're this close to getting the pandemic behind us, but a variant that's more easily transmissible or make people even sicker than COVID-19 we're familiar with will take a firm hold in our community if we don't stay focused and get rid of the virus. Think about all the sacrifices that have been made here over the last 13 months, and obviously lives lost, over 1,000 lives lost just in our community alone. So we've got to stay focused right now, and it's easy to see what happens when focus is lost. We're seeing that in the upper Midwest. We're seeing that in the Northeast. In Europe, where the vaccine has not been as available as what it has been in the country, they're going through a massive surge of the virus, and we're seeing a fourth surge in the virus in parts of our country as well. So we know this can happen if we drop our guard. So everybody's got to stay focused to get us where we need to be right now. Here in Louisville, we're working hard to gain an edge on the virus. By no means should we think that we're out of the woods yet, but even an edge is not the same thing as having a win. And the worst losses are the ones we know we could have prevented, and ones where we know what we need to do, which is the obvious things we've been talking about all along: social distancing and mask, and obviously the vaccine as well. So let's focus what we can do here, get to the other side of the pandemic. There's a goal out there that Governor Fischer announced when we get to 2.5 million Kentuckians, eligible Kentuckians receiving at least their first dose of COVID-19, the state will remove most capacity restrictions. So that would be great news. So we can do this. And today, now, as we get into the program, we're going to hear details about the two sides of this race, about the new Cardinal Stadium vaccination site, and then about the presence of the variants in our cities. But before we jump into that, let's talk about the status of where we're at with the data here in the city and a little more detail on the Janssen vaccine status from Dr. Sarah Moyer, Chief Health Strategist and Director of Louisville Metro Public Health and Wellness. Dr. Moyer, take it away.
Thanks, Mayor. As you mentioned, before I jump into the data, just wanted to talk about the news this morning that the U.S. has paused the rollout of the J&J vaccine due to some reported clotting issues. 6 recipients developed a rare clotting disorder within 2 weeks of vaccination. Nearly 7 million people in the U.S. have received the Johnson & Johnson so far, so that risk that we know is less than 1 in a million. We have not had any reports of clotting in Louisville from people who've received the J&J vaccine so far. That's very encouraging, but we want to be safe, and until we know more, we will pause the use of the J&J vaccine. And I know there's some concerns about a potential issue with the J&J vaccine. I think it's important to note that the system in place for monitoring safety and effectiveness of vaccines is working. People all over the world are able to report any side effects, and that data is pulled and scrutinized. The CDC's Advisory Committee on Immunization Practices is made up of scientists and medical experts who are all reviewing the data and outcomes and making recommendations to the CDC. This pause creates time for more analysis, and changes, if any, are recommended. And that group is meeting tomorrow afternoon to analyze the data more and to make recommendations going forward. We can't lose sight that the fact that COVID-19 was the third leading cause of death in 2020. Too many lives were lost and too many people are still dealing with lingering side effects from the virus. We have plenty of sites available in Jefferson County right now that are giving out the Moderna and Pfizer vaccines. And so no one should have any trouble getting appointments for either of those. So with that, I'm going to do just a quick dive into the data and highlight some few more points. If you look at the dashboard, we are still in that accelerated orange zone. Our case count went up last week to 635 cases reported. Hopefully this is all of you who traveled and got tested when you got back, and encourage anyone who did not to sign up to get tested today. We did find many more reports of the B117 variants in many zip codes across the city. And unfortunately, we had our first case of the P1 or the Brazilian variant was reported over the weekend. It's just another reminder that we are not through this, and despite the news of vaccination this morning, it's still encouraging everyone over the age of 16 to sign up and get vaccinated. And then just quickly on the deaths, we did have 51 deaths reported last week. Majority of these were from the state audit. Only 4 deaths occurred in April so far, which is just another reminder of how safe and efficacious our vaccines really are. For vaccinations, we are making progress. 298,274 people, or 38.8% of our population, has received its first dose. And 174,745, or 22.8%, have completed this series. This is great news and really so much farther than we thought we would be back in January. As you can see in that graph there, the number of first doses, sorry, Scott, just back up real quick. The number of first doses has started to decrease and trend down. This means that we have vaccine appointments that are going unfilled. Everybody over the age of 16, actually, everyone 16 and older qualifies for vaccine today. So please talk to your neighbors, talk to your family. If you know anyone that has not gotten their shot, encourage them to sign up today. And I know Dr. Smith and Dr. Burns are going to be on to talk more about that, the safety of the vaccines and the concerns of the variants. But getting vaccinated is one tool you can use to protect yourself and your loved ones. And once you've been vaccinated, it really gives you the upper hand against the virus, because even if you are exposed, you'll be okay. And as the mayor mentioned, the governor did say that we can lift restrictions when we get to 2.5 million Kentuckians vaccinated. That means in Jefferson County, we need about 150,000 more people to sign up. And we have the capacity to get that done in 3 weeks. And so just really encourage you to talk to your friends and neighbors and get signed up, because that is how we are going to get back to the lives we used to have. So with that, back to you, Mayor, and happy to take questions later.
All right, thank you, Dr. Moyer. So all in all, very encouraging trends. We appreciate that. Okay, so I think also when this is all over, when we're at the other side of the pandemic, I do think that Louisville's rollout of vaccines will take place amongst the great inspirational stories of our city, of people pulling together to help each other and get past the vaccine. And we've seen a lot of our healthcare providers who might look at themselves as competitors from time to time really come together without ego and be great partners throughout this effort. And clearly, we have seen nurses who've been on the front lines for over a year right now, nurses and doctors and all the staff at the hospitals. And they have been getting after this despite exhaustion, near exhaustion, to administer these doses and just provide care. And people from across the community have shown up in a huge way to volunteer whenever we need help. LouVax has been a best practice in the country for that. So just lots of people really coming together. I want to salute U of L Health as being a great partner. They have helped take the lead in the transformational part of our city's efforts to end the pandemic, and that's the new Cardinal Stadium vaccination site. And it's over 24 lanes of impressive capacity to administer shots. I was there yesterday, and the volume that can flow through there is truly amazing. So Dr. Jason Smith was patient 02 when getting the vaccine. And here's an ER doc that has attacked this particular emergency, not only as a great medical professional, but as an entrepreneur and being flexible, whether it's mass vaccination sites, one-on-one, community mobilization. So, Dr. Smith, you've been a real incredible citizen for us here. So I appreciate everything that you've done, and I'll turn the floor to you a little bit to tell us a little bit about the mass vaccination site at Cardinal Stadium and anything else that's on your mind.
You got to, first of all, thank you, Mayor. You know, the great part about the job that I get to do now is working with a team of people that really want to work and help the community. They want to be a part of this community. We've got volunteers from really all over the Commonwealth and all over the country helping us now to bring the vaccine out and deploy the vaccine through Louisville. So couldn't do it without everyone who is there supporting the city and this community. We do have the mass vaccination site that is now open. We did just under 3,000 yesterday. The longest wait time we had from driving up to actually getting the vaccine was 11 minutes. We spend more time waiting and watching than we do actually registering and giving the shot. So that's fantastic news for everyone. We had it down to about 7 minutes there for a little while, and we had all the lanes up and running. And it was actually very steady and a great time yesterday to be out. We're scheduled to give another 3,600 today. So encourage everyone, if you have not made an appointment, please make an appointment. We've got appointments open this week. And if you can't make an appointment by either getting on U of L Health or calling 681-1435, just show up. We've got plenty of people there to register you on site. Happy to take care of you and love to move you, into that category of people that have been vaccinated. I was asked a question on the news the other day, and I think one of the things I told people was that when you have been living with this for so long, and particularly in the healthcare industry, we were scared a lot because we were worried about taking things home. When you get that vaccine, it really is a freeing experience more than anything else. You are still wearing a mask and you're still worried, but you're less worried about, your loved ones or bringing something home to somebody else. And it's hard to describe, but it is a very important part, I think, of what we're going to go through in healing from this COVID pandemic.
No, I just want to echo that, Doc. I mean, for me, it was like a liberating experience, or, if you feel like you're looking over your shoulder all the time to see if somebody's coming up from behind you, that's the way I felt with the virus, because it was just always trying to get you. And after you get your vaccine, you just feel a relief. Now you can still get it, we know that, but it's a far different game. And to me, it's like, okay, I'm keeping my mask on, just a determination that we're going to beat this thing. So really want to encourage people to come out and get their vaccines. We need you. So Doc, what do you see as the biggest challenges right now?
The biggest challenge is getting the vaccine out to the people. For the first time since the pandemic started, we actually have a surplus of vaccine available. It was always in such limited quantities previously that we were restricting who could get it and when you could get it. Now it's open and we've got a lot of appointments at U of L Health, at many of the other healthcare organizations throughout the community. Our own organization will be over at the African American Heritage Center again on Saturday, completing a round of vaccines that we did over there. We need to get and want to get this out to the community. We want to make sure that they know that we're here, answer questions on the side if they have them. I spoke with a number of people coming through yesterday. They were asking questions about the vaccine, to give them the information they need to make a good choice for them and a good choice for their families.
Yeah, no, I had several conversations and most people were just very appreciative. It was available. They were amazed at how efficient it was, and they were going to be spreading the word to their friends, because a lot of folks, I think it's a hassle to get the vaccine, and it's very, very easy and very quick as well. So question, the vaccine we're providing out at Cardinal Stadium is?
Pfizer. So we're using the Pfizer vaccine out of Cardinal Stadium. So 1 dose now, 1 dose 3 weeks later. And we make those appointments all for you when you come through the first time. So there's very little worry or any of that as far as moving through.
Okay. And in terms of residency eligibility, do you have to be from Louisville to get the site there at Cardinal Stadium?
You do not. And that's one thing I want to spread to everyone. We are there to provide the vaccine to anyone who comes through that, we have enough to make sure that we get everyone in, I will call the greater metro Louisville, into southern Indiana, and everyone that calls the hub of our city home, as well as all the surrounding counties or anyone from the Commonwealth that wants to come over.
Okay. And then just as a doc, do you want to comment on the Janssen news here in terms of how you look at that?
Yeah, so the Janssen J&J vaccine, they've got a very specific type of clotting disorder that they noticed during this. And it's again, 6 cases, women between the ages of 18 and 48 over the course of 7 million vaccinations. If you look at the numbers for mortality in that age group, 18 to 48 in women, the mortality is somewhere around about a 0.4 to 0.5%. So if 1 million people got, COVID, 1 million women got this COVID, you would expect somewhere between 4,000 and 5,000 very severe infections or deaths associated with this. And that gives you kind of a relative understanding of the risk of the disease versus the risk for the vaccine. I think as a provider, the bigger worry that I have is you have to be aware of this, because the standard treatments that we use to treat clotting disorders are actually not what you should use to treat this particular one. And that's why it's more concerning from the overall occurrence of this, is that it's just rare and you have to treat it a little bit differently. And that's why we have to keep an eye on this from a vaccine standpoint.
Gotcha. Okay. Any other comments you want to share?
No, I want to thank everyone on the call today for the support. Mayor Fischer, you, and Dr. Moyer. I want to thank you both for all the support you've offered us, offered U of L Health, and for spreading the word and getting the word out about the vaccine site.
Absolutely. Well, we'll keep at it. And maybe, Scott, if you want to throw up the screen once again so people can see how to sign up at Cardinal Stadium. Lots of vaccines available, 3,600 today. Capacity is plentiful as well. So get on up there and get your vaccine on. And then, of course, there's plenty of other locations to sign up around the community as well at louisvilleky.gov/COVID-19. And I would just say where you sign up matters less than when you sign up, because we're driving to that herd immunity, so we can get people vaccinated as quickly as we possibly can. Now, Dr. Mark Burns, he's a regular guest of ours. We appreciate that. As an infectious disease specialist and associate professor for the University of Louisville School of Medicine, is going to share some information with us about the variants in our community. We've been relatively blessed compared to some of the other places in the country and certainly around the world with the lack of variants, but that's starting to change. So he's going to talk about the B.1.1.7 variant that's causing a lot of problems overseas and regions of our own country, and obvious anxiety as well. So Dr. Burns, welcome.
Thank you, Mayor. Thanks for having me today. To talk briefly about the variants, just so you know, the CDC has classified variants in sort of 3 categories, if you will. There are what's called variants of interest, variants of concern, and then variants of high consequence. And the variants I'm going to talk about briefly are more variants of concern, particularly the B.1.1.7. B.1.1.7 originated in the United Kingdom and was first identified here in the U.S. in December of 2020. Now, it's been shown that this particular variant is much more contagious and much more transmissible than the original version of the coronavirus that we will refer to as the wild type. It's been shown to be at least 50% more transmissible. Also, it's shown that it is likely responsible for increased hospitalizations and case fatality rates as well too. Initially, we were looking to see if there were an increase in numbers of fatalities, but it's actually starting to point that way. So we're looking at, again, if this has been the likely cause. In addition, one other sort of troubling fact about this are monoclonal antibodies that are used for mild COVID to keep people out of the hospital. It's been shown that the B.1.1.7 variant is is somewhat resistant to some of the monoclonal antibodies that are used. So right now, it is the most common type that is here in the United States, replacing the original wild type. So unfortunately, Mayor, that's the bad news that I have. The good news, however, is that our vaccines that are available are still showing that they are safe and effective against this particular variant, along with the other variants that I'll just mention real briefly, the B1351, the one from South Africa, and the P1, the Brazilian variant. So what we can do through doubling down rigorous compliance with public health mitigating measures, wearing masks, social distancing, washing hands, in addition to getting vaccinated, these things are going to be the way that we fight this off, Mayor.
Thanks, Doc. We're seeing a lot less prevalence of these variants in Louisville than other parts of the country. You want to explain why and how quickly that can change?
Well, probably one of the factors that's involved is, again, these are in the more highly populated areas if you look case by case. However, they are spread throughout the United States, and everyone does at this point now, according to the CDC, sort of have their fair share, if you will, of number of cases that are present. Of course, the higher the population, the more you're going to have these available. But now, again, what we can do about the spread of that, again, being vaccinated is probably going to be the key, in addition to the public health mitigating measures to fight this. And unfortunately, it's not only that. As Dr. Moyer pointed out, there was a case of P1 noted here in Kentucky as well. But as far as we know right now, that's the only case.
Okay. They can spread very rapidly, though. We're seeing that in other cities, as you said, more transmissible.
Yes, sir. Much more contagious. Yes.
And originally, we didn't think they were more deadly, but you're saying there's evidence proving that
Yeah.
that may not be the case.
That may not be the case because we're having more hospitalizations, and unfortunately, with more hospitalizations, there's more instances of death that can occur.
Mm-hmm. Just like to note, as Dr. Moyer pointed out, our hospitalization rates are at what, Sarah, probably a 6 to 8 month low here. So we're not seeing that here locally. We can continue to hold that progress by people getting vaccinated and masking up as well. Dr. Burns, I'm hearing from people who've had the virus, they think they're safe and they don't need the vaccine. Can you comment on that?
Sure. Yeah. Unfortunately, that's a false statement. They've done studies to show that the antibodies that a person would generate against what we'll call the wild type coronavirus, they do not protect you against the variants, the B117 or even the B1351 or the P1. However, they have shown that antibodies generated by the vaccines do offer a degree of protection against the variants. So again, all the more reason to get vaccinated, even if you've had COVID-19.
Mm-hmm. And then any comments on when vaccine may be available for the 12 to 16-year-old? That's the next category that's going through the clinical trials. Is that right?
Yes, sir. Yeah, Pfizer is in the process of doing studies right now. They actually came out with a statement, I believe, in the past week, stating that their efficacy is 100% for the age group of 12 to 15. And they will be applying for emergency use authorization for this very, very soon.
Mm-hmm. And can you tell us why are we starting to see more infections nationally, at least the news, in our younger population?
Well, so far the emphasis on vaccinations have been on the older population. And we've been sort of leaving it up, if you will, to the younger groups to sort of follow the public health mitigating measures. However, from probably a lot of the pictures that you see on television, particularly spring break and taking vacations, there are quite a few people that are masking and social distancing. And it's actually shown now that the largest percentage of hospitalizations are in that 30 to 40-year-old group. So that's likely responsible for many of these types of cases.
And I think it speaks to the nature of the virus, right? It's going to find the people that are not vaccinated, and that's what its job is. And you can't hide from this thing.
Unfortunately, that's true.
Okay, Doc. Well, thanks for joining us. If you'd stay on for our media questions, we'd appreciate that. You guys have been helping out in a whole lot of ways here, just as our Give a Day volunteers have been. This whole month is the Give a Day month, so be sure that if you want to help and volunteer, sign up at mygiveaday.com. There's lots of opportunities for that. So with that, Jess, let's go to our media questions.
Okay, thanks, Mayor. We have 2 questions in the chat about the J&J vaccine, so we'll start with those. The first is from Paul Miles with 840 WHAS, and we'll open this one up to all doctors. He says, what is your message to people who have received the J&J vaccine and may be worried about today's recommendation from the FDA? Dr. Smith, do you want to start with that?
Sure. So what I would tell them is keep an eye on their overall health. That's what we give everyone as far as anything regarding the vaccine administration. The risk of complications that we're currently seeing from this is really not something that I would tell the general population to be too worried about. It's still an exceedingly rare complication or exceedingly rare problem. If you do have, signs and symptoms of severe headache, blurred vision, things like that, please contact us or contact a medical professional. What I'll tell you is that most of the time, the people that are going to experience symptoms for this would be contacting a medical professional anyways. But it's really rare. And I don't think that I would in general tell people to be too worried about it, other than just keeping an eye on their own healthcare.
Dr. Burns and Dr. Moyer, would you like to add anything to that?
Yeah, sure. I'll just add. I mean, I agree 100% with everything Dr. Smith said. Yeah, you want to watch out for things like, as he mentioned, headaches. You might also consider if you have problems with abdominal pain, leg pain, those types of things. Again, you want to contact your provider. They have shown that a lot of the headaches in particular are caused by venous sinus thrombosis. And as Dr. Smith mentioned earlier, that you don't want to use heparin for that type of treatment. They do believe it may be an autoimmune reaction, but still, both the FDA and the CDC are investigating right now. So, but yeah, if you have any of those symptoms and you've received the J&J vaccine, definitely notify your primary care provider. And if it is severe, you may have to contact someone on an emergency basis.
And just to add to that, just a reminder that you still made the right choice about getting the J&J. Don't stress about that. As they keep mentioning, it's very, very rare complication. It's more so our healthcare providers can be prepared if they see it, so they can treat it correctly when it does show up in the hospital. So you got the J&J, just feel safe that you are now protected against COVID, which is much more deadly and has much worse side effects than we know the vaccine has right now.
And I think isn't that kind of the common sense answer there too, that y'all are saying is if a million people didn't get the Janssen vaccine, the fatalities from that are going to be much greater than any potential concern that could be coming from this blood clot situation right now. So is that correct?
Yeah, that's correct. I think, again, if you look at this and you look at 1 million people that would get COVID-19, in general, in the age groups that we're talking about, you're talking about between 3,000 and 5,000 people out of that 1 million will get a severe infection requiring prolonged hospitalization or eventually die from this disease. Because we like to remind people, we do have people in their 20s that are dying from COVID-19. Much less common than older patients, but it still happens. And so the risk of that occurring is much higher than the risk associated with any of the clotting disorders that we're talking about with the J&J. And I would also say that this is the only vaccine that we currently have that has had any kind of concern or trouble associated with its rollout. Both Moderna and the Pfizer, we've given, almost 100 million doses, I believe, thus far, and we haven't seen anything like this. So I feel much more confident in both of those, given what we've seen and what we've experienced of the overall population.
Okay. So lots more information coming out, I believe, tomorrow from the CDC on this. So stay tuned. Okay. Thanks, Jess.
Okay, our next question is from Debbie Yetter with the Courier-Journal. This is for Dr. Smith. She asks, are you concerned that the news about the J&J vaccine will prevent people from getting any vaccine? And what is standard treatment for blood clots?
Yeah, so we'll start with the standard treatment for blood clots. So in general, if you develop a blood clot, you're going to be on a blood thinner, either heparin or some of the other blood thinners that we give people. The problem with the particular complication that they were noting with the J&J vaccine is that it actually occurs in one of the veins actually in your head. And you have to be very careful about administering heparin to those people. We may need to do it, and it's something that we often do. However, we have to have some particular things that we do to monitor that and watch that, compared to someone who had a blood clot, say, in their leg or in their chest or something. That's the biggest problem you come up with, is that if you see something like this, you have to go down a little bit different treatment algorithm than you would for other blood clots and things. Am I worried it would deter people? Yes. I'm not going to lie. Anytime you hear any kind of bad news about any of these things, people tend to latch onto that as proof of what they want or don't want to hear. The simple fact of the matter is that the vaccines, regardless right now, are much better for you than getting COVID. Even if you look at any of the other trials or things that occurred with this, they look completely and safe. I think the CDC and FDA acted out of an abundance of caution. I will tell you that in the general population, the risk of developing the most severe complication is between 3 and 5 in a million. We're talking about 7 in a million. Only reason I tend to know about this is it tends to happen in younger patients after traumatic injuries. So I see people who come into trauma that may have this happen. That's how I know more about this particular complication. But it's still exceedingly rare. I've seen it a couple times in my career. And I think that's one of the things we have to get through to people, is just because you have some minor setbacks does not mean that you step back against everything we're doing, because it is better for us, it is better for you, it's better for your family and your community if you get the vaccine, and that we get through the COVID pandemic.
Thank you. Our next question is from Chelsea Washington with Spectrum News. Dr. Moyer, the next two questions are for you. She asks, the homeless first got this vaccine, so what is the next move? And she followed up to ask if we will continue to use the vaccine on the homeless population.
We're pausing using the J&J vaccine on anyone right now until we get further recommendations from the CDC and the FDA. My hope is that they'll decide that it's still safe and acceptable. And if they do, then we will continue. But in the meantime, all of our missions are going to be using the Moderna and Pfizer vaccine while we find out more information. And I know the homeless did get that vaccine. It is a lot easier to go out into the field with the J&J vaccine, and it only requires 1 dose. So it was ideal in situations where it's harder to find people 3 or 4 weeks later. So I know they, just like anything else, they'll be getting great care from our healthcare systems, whether it's family health centers with the Phoenix Center or both of our hospitals, and they'll be at the lookout for the complication if it does happen.
And then, Dr. Moyer, I read where the symptoms with Janssen are appearing 6 to 13 days after the vaccine. I know it's preliminary, but does that mean if you're beyond that window that you don't need to worry about it?
I think yes, but we'll wait and see from our CDC partners. And Dr. Smith, if you have anything to add.
No, I would agree. And I think, again, you have to monitor your own health after one of these vaccine administrations. But in general, we haven't given 1 million doses of J&J in the state yet. I'm not even sure we've given 100,000 doses of J&J in the state yet. I wouldn't expect to see this complication in the entire state of Kentucky, given the number of doses we've given nor would I expect it. I mean, if we really started rolling out to see this in any large numbers beyond what I would see occasionally coming through the hospital system itself.
And I would echo that as well too. I was going to say I'm sure we haven't even given 1 million doses out, so I really don't expect to see this complication either, to be honest with you.
Yeah, we've given out 5,563 Janssen vaccines between all of our partners to Jefferson County residents so far. So nowhere near 1 million. So chances are having any complications in Jefferson County residents is very small.
Thank you. Our next question is for Dr. Moyer from Drew Gardner with WLKY. He asks if there are any updates on the next steps for LUVAX Mobile.
So LUVAX Mobile is very active. We have completed 29 missions since March 22nd and have 11 planned for the next week. I think our biggest challenge is switching those missions to Moderna and Pfizer vaccine over the coming week, but they are still going on as planned. And we're just going to be planning for second dose missions to go out to make sure everyone is fully protected. And those numbers of missions will continue to ramp up as LUVAX broadband ramps down. So if anyone is interested, if you have a population that either has a hard time getting to one of the mass vaccination clinics or the pharmacy in your neighborhood, please email us at luvaxmobile@louisvilleky.gov, and we'd love to set you up with a mobile mission as well.
Thank you. The next question is from Elizabeth Pace. She says, Dr. Moyer mentioned that the Brazilian variant was detected over the weekend. How many variants are present in Jefferson County, and which is the most prevalent? Dr. Burns, do you want to take that question?
Sure. Yeah, I can tell you the most prevalent of the other variants is going to be the B117. Okay. Now, again, the P1 just showed up over the weekend. And to my knowledge, and Dr. Moyer may have more information, but to my knowledge, that's the only case of a P1 variant that we've seen in our area here.
That is correct. We've had about 35 confirmed cases of the B117 and just one of the P1. I know that P1 was really more common in Florida, and so expect that to increase as people come back from vacation there. So just a reminder, please get tested and isolate and quarantine for those 7 to 14 days if you do go out of town, because we do not want that to be widespread like it is in other parts of the country.
And Dr. Moyer, can you tell us how we're detecting those variants, and then what the role of the wastewater study is with this also?
Yeah, so much like how COVID testing was limited when we first started this pandemic, the surveillance testing on for variants is limited. So our lab partners are looking for mutation in the COVID if it tests positive. And if that's the case, they send it off to the state lab to confirm if there is a variant of concern present or not. So it's a random sampling of labs that gets sent there. It is not every test. So we know that we are not catching every single one, but are keeping an eye on the trends and locations in the city where the variants of concerns are present. And then the wastewater study helps us in conjunction with that, since we know we're not catching every single one, to know if the variants are spreading and what areas of town they're also in. So the wastewater is matching what we're seeing in people with that B117 prevalent in majority of our county, and then the P1 in just one zip code in town, or one catch basin with the sewage water. So it's consistent, and it just helps us keep ahead of the game. It takes a couple weeks to get the human testing back, and so the wastewater helps us stay ahead of that. If we need to target vaccine missions to certain parts of town, encourage people to sign up to get vaccinated, as well as help them talk through their concerns so they feel comfortable getting vaccinated as well. And just a reminder that the variants are higher in zip codes that have lower vaccination rates. So please check out our website, look at those maps again. If you're in a zip code that has a lower vaccination rate, please talk to your neighbors and family and friends and sign up to get vaccinated today.
And the last question in the chat is from Debbie Getter with the Courier Journal. She says, how many doses of the J&J vaccine have been given in Jefferson County and to whom primarily? Dr. Moyer, I know you touched on that a little earlier. Do you have anything to add?
Yeah, there's just over 5,000 doses have been given, so 5,563. At the health department, we've used it mostly in places where it's harder to follow up for that second dose. We've used it in our homeless encampment missions and as well as the homeless clinic, corrections, and some other mobile events. So about 900 those doses were given to those populations. I'll let Dr. Smith, I believe, has gotten some as well too, and many of our pharmacy partners have it as well. So I think the rest of that 4,000 is probably just general population.
And then, Doc, just to clarify, probably the number of homeless folks that have received the Janssen is in the neighborhood of 200 or so.
Hard to know for sure because it's not a question, we guess, but about 900 of the doses have been given in our LUVAX mobile missions. So that includes homeless, corrections, as well as weekend events that we've done for walk up as well.
Thank you.
Yeah, and I will say that U of L Health has given 1,100 doses, just under 1,100 doses. We did that on Thursday and Friday of last week. We did that basically for the opening and the testing of the drive-through site, simply because the 3-week follow-up would have been during Oaks and Derby. We thought that would be a little bit extraordinary to have people come and do that. But thus far, we've not had any issues or problems associated with the administration of those vaccines.
Okay, Mayor, that is the last question in the chat.
Okay, well, thanks everybody for joining us today. And again, thanks to all of our volunteers. Thanks to our partners at U of L Health, Dr. Smith, Dr. Burns, Dr. Moyer. Thanks to everybody at the Public Health Department. And let's stay focused here as we work to herd immunity. So everybody stay safe. Thank you.